Hi there, this is Jennifer Zaragoza, and this is a recap of Clara, 18-year-old female that was here. Unfortunately, she is ill, and so we are going to pick up where we left off. 18-year-old Clara came in with headaches. She described it as a tight band around her head. She rated her pain as a 6, and the headache had started the previous morning. She had no relieving factors with over-the-counter medication. She said that it didn't radiate anywhere. She described it as dull. She said that it was unrelenting. It didn't get better or easier at any point. She also said that there was no vomiting with the headache, no fever. She denied changes in blurring or halos, denies an aura with a headache, denies seizure, trauma, any falls or fainting, syncopal episodes, denied myalgias. She denied any recent falls or lumbar punctures. Family history was negative for any major diseases, no major headaches or any headaches that run in the family, negative for neurological problems. On the social aspect, she denied any use of illegal drugs, any use of alcohol. She said she had never tried it before, denies regular use of caffeine, denies exposure to toxins or no strange smells in the house. And so now I'm ready to begin, after we had reviewed systems before, to do the physical exam of that. So we'll begin that part. Hi there, my name is Jennifer Zaragoza, and I'll be your nurse practitioner today. I'm sorry that you're suffering with a headache. Can you tell me your name and your date of birth?
My name is Aiden Uriah Payami. I live in San Antonio, Texas, and I was born on May 13, 2004.
Okay. And do you know where you are?
San Antonio, Texas.
Okay, great. And do you know what day it is today?
What day it is? Why I believe it's the 14th.
Okay, great. Okay, so on the general appearance, he appears to be well groomed. He behaves appropriately. He communicates without difficulty. He dresses appropriate for the weather. It's hot outside. So now we will begin to look at his head. So head is the appropriate size. It's symmetrical. Features on it are symmetrical. I don't see any lumps or bumps. And then we will begin examination of the head. So we'll first start with the eyes. So the eyes are appropriately located in the head. They're the right size and the shape. They're even and symmetrical. And then we will take a look at the lacrimation. So it looks like his eyes are moist, so they're lacrimating appropriately. We see tears or water in the bottom. Also, we look at inspect the lid. Periorbital area does not have any swelling. The eyelid doesn't have any ptosis or meiosis. And then now we will look inside the eye. Okay, I'm going to look inside your eye, and this is a bright light. So I'm going to shine this right in. Okay, so we are looking at the fundus. We are looking for the cup and the disc. We see the retinal artery, no venous pulsations or papilledema. We see the presence of a red reflex. Sorry, that was really bright there, Aiden. Now we'll look at the other side. I'll give you a minute to adjust there.
I see a dark spot in the center.
I know, that's from the light. It takes a minute.
I can still see the green. I mean, not the ring.
The ring of the light, yeah, it's very, very bright. So, okay, so now I'm gonna look at this side. I'm gonna look at the fundus of the eye again. Okay, so I'm gonna get really close to you here. And I see the cup and the disc. You see the right retinal artery. No venous pulsations. No papilledema, and the presence of the red reflex. So all those things are good. I'll let you adjust there for a second. It's very bright, I know. Tell me when you're ready. Okay. Next, I'm gonna check for visual acuity. Yes, thank you for putting your glasses on. And so what I'm gonna have you do is read as far down as you can and read the lowest level on this chart. It's called the Snellen chart.
The lowest one I can probably see is 10.
Okay, number 10. Okay, that's great. Can you read it for me?
F. I think that's either a Q or an O.
Okay, good.
F L T C E D.
Okay, you are reading.
Wait, no.
Oh,
That's an O.
it is an O. You're right. So you're reading at 2010. So that's awesome. The chart next to it is called the tumbling E chart. So if you could pick a line that you can read the lowest and tell me which direction that E is facing.
I'll try the very bottom one.
Okay.
The E is facing the right.
Okay.
Next one is facing down, left, right, up, right.
Perfect. Great. So that is the best vision on that. So very good. Very good. No problems with visual acuity. Now we're going to do something. Here. I'm going to check your pupils. So if you can take your glasses off one more time. Okay. So just look straight ahead. Actually, I'm going to stand in front of you and look at my nose. And I am checking your pupils. And this, we are looking to see if your pupils are equal, round, reactive to light and accommodation, which they are. From here, we're going to check direct and consensual constriction of the pupils, and the way that we do that is you're gonna take your glasses off again, and you're gonna look straight ahead. And I'm gonna look to see if this pupil constricts and that pupil constricts right after it. So this one constricts, and then that one constricts right after it. We'll do that, just check it a couple of times. Constriction, followed by constriction. This one constricts, and then that one constricts, so that's normal. So swinging light test is the way that we check direct and direct confrontation of the eyes. And then next we will check our visual fields. And so I'm going to stand right in front of you, and you're going to look at my nose, and I want you to cover one eye. Okay? And then I want you to tell me what number it is that you see. Without looking at it, you're going to look straight at me. You're going to use your peripheral vision to tell me what number it is.
1, 2, 3.
Okay, same, just leave it just like that, and we're going to do this side.
1, 2, 2.
Okay. All right, good. Now let's do the other eye. Cover the other eye. I'll give you a chance to adjust there. And again, what number?
1, 2, 2.
Okay. And then again.
1, 1, 2.
Okay, good. So visual fields, all 6 are intact there. So good job on the eyes. So next we will check the ears. We're going to inspect the ears for symmetry. We're going to check them for alignment. They're equal on the head on both sides. The pinna is present, and so now we're ready to look inside of the ears. So the external ear is clear. I'm gonna pull up on the ear. I'm gonna look into the canal. The canal is unobstructed. There's no redness, swelling, no purulence. The tympanic membrane is visualized. There's reflective light. I see the cone of light. It's shiny. There seems to be no fluid present on the eardrum. Okay. And then we will look in the other ear, again, inspecting the external ear. We'll look into the ear canal. There's no redness, no drainage, no purulence. I see the tympanic membrane. It's shiny and reflective. I see the cone of light, and there's no fluid noted on the eardrum. So ears look good there. Now we can perform the whisper test. That is also cranial nerve number 8, and the way that we test that is if you'll cover this ear on this side, there you go, and then I'm gonna whisper a number, and you are gonna tell me what number it is.
3.
Good. Now we're gonna do the same thing on the other ear if you'll cover that.
2.
Good. So cranial nerve number 8 is intact. We also are going to check the mouth. Okay, so the first thing I do is I inspect the mouth. The first is the lips. The lips are symmetrical. Then I'm going to have you open your mouth and I'm going to look inside. So the mouth is pink. The mucous membranes are wet. I'm going to look into the buccal cavity. It's wet. No signs and symptoms of fungal infection, no discolorations. Stick out your tongue. Tongue looks normal. Uvula is midline. And then say, okay. Tonsils are within the papillar tower. There's no purulence, drainage, swelling in the throat. And then can you lift up your tongue? And then the base of the tongue is normal. There looks like there's no ulcers and no infections. And then I'm gonna push on your teeth here, Aiden. Do you have any pain anywhere in your teeth? All the teeth are present. No signs and symptoms of gingivitis, tooth decay. Dentation looks all normal there. I'm also going to have you, let me look also in your throat, open your and then say so we're also looking to see if the palate raises equally, and one side is not raising higher than the other on that. That is cranial nerve 9 and 10. And we also, with that, we check the gag reflex. So while we're here and we have the tongue blade, I'm gonna have you open your mouth and I'm gonna just see if the gag reflex is present. That doesn't make you gag a little bit? No? Okay, there he goes. A little bit?
Only a little bit.
A little bit? Okay. So, gag reflex present. If we stick the tongue blade in deep enough there on
I can taste the wood.
You can taste the wood. Sorry about that. So on this, so that was our mouth exam, and from here I'm going to also check your neck. And so on this, we inspect the neck first. And so first of all, we inspect the thyroid, and we're also inspecting for the position of the trachea. Trachea looks midline. Thyroid, I mean, we're gonna palpate for that. I'm gonna feel here. Palpate the thyroid, and then we're also gonna auscultate the thyroid. A gentle swoosh over the thyroid is heard. Now we're going to palpate for the carotid. So on both sides, we're going to feel for the carotid. And I feel the carotid on both sides, and then we're going to auscultate the carotid.
Isn't that where most blood is?
What's that?
Most blood?
No, I'm just going to listen. So I was able to auscultate the carotids on both sides with both the bell and the diaphragm, and no breeze were heard on auscultation. The next I'm going to check for in the neck is the lymph nodes, and so the first lymph node I'm going to check is the occipital lymph node. So right back here, I'm just going to feel around on your neck. So this is the occipital lymph node. Okay, and then the pre-auricular lymph nodes. Okay, post-auricular lymph nodes, tonsillar lymph nodes, submandibular lymph nodes, submental lymph nodes. And then here we're going to have the pre-cervical lymph nodes. Does it tickle? Post-cervical lymph nodes.
No, it doesn't tickle.
And then right down here, the supraclavicular lymph nodes on both sides. Sorry, my hands are cold. Here you go.
I take cold showers, I'm used to it.
Okay. There we go. Okay, so we've done head, neck, ears, eyes, mouth, and so we need to look in your nose. So the first thing we know with the nose is the position and the alignment. His nose is straight, and it doesn't have any deviations, and it looks symmetrical to right from the left. Okay, so now Aiden, I'm going to look inside your nose. Did you break the glasses?
Yeah.
No? Okay.
I just need to tighten them or can fix.
Okay, so now I'm going, after I've looked at the outside of your nose, I'm going to look at the inside of your nose. Okay, so it's patent on both sides. No nasal polyps. The mucous membrane is pink and moist, and there's no septal deviations on the nose. And while we're here, I'm going to have you close your eyes, Aiden. I'm going to have you close your eyes, and I'm going to have you tell me what you smell with your eyes closed.
Alcohol?
Yep, that's good. So that is actually our first cranial nerve. It's the olfactory nerve, and it is a sense for smell. Okay. So the next thing I'm gonna do is I'm gonna listen to your lungs. Okay. So for this one, if you don't mind, I'm gonna have you take your shirt off. Okay, so the first thing on the lungs is I'm gonna note the symmetry of his chest. If you'll sit up for me, just real straight. He's sitting up comfortably. He's not using. He's breathing comfortably. He's not using any accessory muscles to breathe. No intercostal retractions, and his breathing rate is normal. So now I've noticed that his chest is symmetrical on both sides, and now I am ready to auscultate. So if you could take a deep breath and out and in and out and in and out, in and out, in and out, Okay, now I'm gonna listen on your back. Take a deep breath in and out, in and out, in and out. Good. In and out. And on this side, in and out. And I listen with both the bell and the diaphragm on that. And then the next thing I'm going to do is I'm going to percuss the lungs. So I'm going to have you lay back just a little bit. Sorry if I scratched you.
Scratch me where?
I think maybe I scratched myself. And I'm going to do the same thing on your back if you could lean forward. One more. So the lungs are resonant in all fields. And so the next thing I'm going to do is I'm going to check for tactile fremulus, and the way that I do that is I'm going to have you ooch forward a little bit in the chair. Since this isn't a regular exam, just can you kind of scoot forward a little bit, right there. And so now I'm going to have you say the number 99.
99. 99.
One more time.
99.
Good. And then I'm going. All of the vibrations that I hear with the number 99 is all sounds normal and symmetrical and even to me. And then we're going to check for tactile fremulus, frenulus, and on that I'm going to have him say the letter E. And so say the letter E.
E.
Again.
E.
One more.
The letter E.
The E all sounds like the letter E, and if it were to sound like the letter A, that would be abnormal. That would be egophony. So we don't have any of that noted. So the next thing we're going to look for is the heart. We're going to check the chest for any pulsations. And then we are going to also we are also going to palpate the precordium. So I'm going to do that by just putting my hands on his chest, and I'm feeling for heaves or thrusts. This is the precordium. And I don't feel any of that, and so now I am ready to listen to his heart. So the first thing I'm going to listen to is going to be the atrial valve, and that is at the second intercostal space. Right here. Then I'm going to listen to the pulmonic valve. That's the left side, also second intercostal space. Erb's point is located one intercostal space below the pulmonic valve, so right here. Then we move down to the left lower sternal border. We're going to be listening to the tricuspid valve. That is between the fourth and fifth on the fourth or fifth intercostal space. Left lower sternal border. The last one is the mitral valve, and that is going to be at the apex of the heart, which is located laterally. Oh, sorry, it's cold. Next, we're going to listen for the apical pulse, which is the fourth and fifth intercostal space, mid-clavicular line, and we listen for 1 full minute. So apical heart rate is 72. And I'm also going to note that because he's at about 60 degrees, that he doesn't have any jugular vein distension. So then we're going to repeat this at him with him at 90 degrees. So I'm going to have you sit straight up, and then we'll listen to all of these again. And then we're also going to do this in a third position. I'm going to have you lean forward a little bit. The reason that we listen leaning forward is so that we can hear any murmurs. It helps us hear those better. So we've done heart and lungs now, and so I want to note that on his heart rate that we hear S1 and S2. We do not hear any clicks, murmurs, or a splitting with the heart in any of those positions. Lastly, as part of this exam for headaches, we're also going to do a full cranial nerve check as well. We have done cranial number 1, which is olfactory. We've done cranial number 2, which was visual acuity. 3, 4, and 6 are ocular, motor, trochlear, and abductans, and that is what we look for with extraocular movement, and so we're going to do that test now. So I'm going to stand in front of you, and I'm going to hold up my finger, and I'm going to have you follow my finger with your eyes. So we're going to go. So with that test, I don't see any extraocular movements, and I don't see any nystagmus. So that takes us to cranial nerve number 5, which is facial. So on that, we check for corneal reflex. So you don't have to take your glasses off, but I'm just going to corneal reflex intact. So what we want is the blinking. That's what we want with that. So it might make your eyes tear up a little bit too. Another way to check the facial is I put my hands right here on the masseter muscle, and I have you clench your teeth. Okay, and so that is symmetrical on both sides. And then I'm gonna try to pull down on your jaw, and you're gonna try to stop me. You're gonna try to close your mouth. Now I'm gonna try to push down, and you're gonna try to stop me. Okay, so we've got some strength in the mandible, so that's also what we want with facial nerve number 5. Cranial nerve number 7, we're going to stand back and we're going to look at the face. So if you can just look at me, we are looking for facial weakness or paralysis. On his face, it is completely symmetrical. And specifically, we're going to have you smile. If you can smile for me. Smile is equal, and I'm also looking at his nasolabial folds to see if there's any drooping on one side or the other. Another thing we're going to look at is the palpebral width. So I'm looking at the side of the eye, and I'm seeing if the width of the upper and lower lid is wider. That would indicate a 7th cranial nerve problem. We've done the whisper test. We've noted that the 8th cranial nerve is the auditory, and that one is intact. He passed the whisper test. 9 and 10 is the hypoglossal cranial nerve. The pharyngeal cranial nerve, and that is tested with both when we say ah, his palate raised, and also we did get somewhat of a gag reflex, which indicates 9 and 10 are intact. Number 11 is the spinal accessory muscle, so I'm going to have you sit forward. The first one that we're going to test is the sternocleidomastoid muscle, and so what I'm going to do is I'm going to put my hand right here on your face, and I'm going to have you try to look that way against, there you go. So we note that that muscle is moving, that nerve is moving, and then again, push against my face to turn your head. Perfect. Good. Okay, so that one, the sternocleidomastoid is intact. Next we are going to check is the trapezius. So I'm going to put both hands on your shoulders, and I'm going to have you shrug your shoulders against pressure. Okay. So also the trapezius, the shrugging is symmetrical strength on both sides for both the sternocleidomastoid and the trapezius muscle. The last cranial nerve that we check is number 12. That's a hypoglossal muscle nerve. And so what I'm going to have you do is stick your tongue out. There you go. And so on this one, we're looking for any deviations of the tongue. That's good. It comes out evenly. It doesn't deviate to one side or the other. So that concludes our general head, ears, eyes, nose, throat, neck, heart and lung exam. So thank you for your help. I hope your headaches will be feeling better soon.